Потому что держать всех боятся расходить.
Because they're trying not to have any people in the hospital because they cannot provide the shelter for everybody. So they say better go home and find shelter.
Alevtyna Markina was told not to come back to the hospital in Ukraine where she had began her cancer treatments due to the Russian invasion and the lack of medication available. Like so many others, she had to flee Poland and leave her husband behind. When she did, her daughter from Montreal, Alevtyna, took a 48-hour trip to bring her mom back to Quebec in hopes of continuing her cancer treatment. Alevtyna had a visitor visa from 2019 that was able to carry through and get her here, but it's been a challenge to get the medical care she needs.
She just stamped her passport and they wrote that she can leave in 2025. I've been told just show the stamp in the hospital and that's going to be her proof of status.
Ukrainians fleeing the war will be able to stay in Canada for 3 years and obtain an open work permit free of charge, allowing them to access provincial health care, a document Alevtyna's mother was not given at the airport.
When you go to the hospital, they see it and they say, okay, but what is it? Where is your visitor record? Or where is your Blue Cross for refugees? Because everybody says Ukrainian refugees, but they're not refugees. So there is a big confusion.
There is a level of bureaucratic red tape that becomes a barrier.
Patients' rights advocate Sita Ramdas says getting individuals treatments they need is delayed due to a lack of communication from the top down, as well as a lack of training in situations like Olena's.
They're not trained in all these complicated pieces of paperwork as to how to signal the type or the classification of a newcomer to Canada in that paperwork.
The Quebec Ministry of Health and Social Services tells City News in a statement, as soon as they arrive on Quebec soil, Ukrainian nationals can benefit from health insurance and the public prescription drug insurance plan, adding that the continuation of cancer treatments are covered and supported. But Alevtyna says the difference in answers from top down is proving difficult for her to move forward. Her mother has not been approved for Quebec's public health insurance plan known as RAMQ.
When they go to the hospital, where like everybody's really nice and they say like they're trying to help and they do tests, but like, you know, if ever something happens with their RAMQ, they're gonna send me the bill. So I've been told that she's covered from the first day, but still it's like kind of question in the air.
It's great that our nation is so open to receiving and helping others, but then once they get here, there is the reality of actually delivering the care that they need in the way that they need. That's a big challenge.
In Montreal, Felisha Adam, City News.